Hello, everybody, and welcome to another episode of the SITREP. You've got all three of us here today, Mike, Paul, and Jim, and answering a question that we got via email. What is Tricare versus VA healthcare? What's the difference? And this is something that I don't know anything about Tricare other than the fact that
there's Tricare.
That it exists, but
heard of it.
I know plenty about VA healthcare, but Tricare, I know nothing about. And the first question I'm going to pose to the both of you: can Tricare and VA be used together?
Yeah. Yes. I mean, Tricare is just another healthcare option that service members get for retiring from active duty or from National Guard and Reserve service. It's just like, or it's similar to if you have Blue Cross Blue Shield or, what have you. So, yes, they can be used together. Jim, I mean, I know you do it all the time.
Yeah, you live in a rural place sometimes. It benefits you to be able to go wherever you need to at your convenience and not, when the doctor says, well, I can't do it until. If I'm at a VA facility or near a VA facility, I head in there and get my stuff done. If I'm out in town or maybe I'm on leave somewhere or whatever, I may go see my private doctor. But I utilize them both, and again, at my convenience. It's whatever suits me best. They don't fight. They don't argue with each other. I don't hear anything from either side. I just know a bill gets paid, and I'm not the person paying it.
That's a pretty important part of it.
I mean, and that's a very important part of it since, obviously you're a retiree. You've got Tricare for life. But you also have the ability and do use the ability of VA healthcare. And I think another important point, similar to other forms of health insurance, is, Tricare is not paying for the hearing aids you have, correct? I mean, if you need hearing aids, Tricare is not paying for that. Is that correct?
Correct, right. Tricare will pay for my hearing test.
Right.
They'll pay for my eye exam, but it's up to me to get those glasses or to get those hearing aids. So that's why I come to the VA, and specifically for those two items, I don't pay anything for.
Yeah, that's a lot of money.
Well, sure, yeah. You're talking anywhere between $4,000 and $8,000 nowadays for hearing aids.
Jeez.
And that's just to get them. That doesn't count. Okay, they need to be adjusted. You need
3 follow-up visits.
Right.
Yeah.
And I think the other thing, Tricare is a wonderful service. I mean, a wonderful option for a lot of people, and
especially to get a family, right?
Right, and it's well deserved. So that's your opportunity to have your family on a healthcare plan that's not costing you or costing you very little, as far as premiums and things along that nature. But yeah, I would strongly encourage any veteran that if you're on Tricare, if you're a retiree from either, as I said, either active duty or the Guard and Reserves, because those folks are eligible for Tricare once they start drawing their military pay at age 60, or if, depending on the number of deployments they had, they can have up to 4 years deducted from age 60. So once you're eligible and you're drawing your retirement pay as a Guard or Reservist, then you're eligible also for Tricare. So a lot of folks then opt into that. But at the same time, I would strongly encourage you to either utilize the VA or continue to utilize the VA, because there are, as Jim talked about, there are so many options that are available through the VA that may not be as readily available through a civilian provider on Tricare, or will cost you money using your Tricare benefit.
I think one of the big pieces, too, is Tricare is an insurance. I mean, that's essentially what it is. The VA is health care.
It's a benefit.
Right. It's something I've gotten. I've earned it. And I don't have to worry about, if I utilize Tricare, I'm going to different places for different things. It's not one-stop shopping like I get at the VA. I go to the VA. If I've got to come in and my doctor says, I need to get you an MRI, I'm just moving off into another section of the hospital and getting it done. Whereas if I'm out in town, I see my private doctor, well, let's do some physical therapy first, and then let's do this, and then I'm going to places all around the state sometimes, if not other places, to get this work done, and I'm hoping they're all communicating. And essentially, that should be happening. I know with the VA, it's a whole team approach where everybody's talking to everybody. So my doctor is talking to the folks with the MRIs and anything else being done. if I come in for another appointment, they look and say, oh, well, I see you had an MRI last week and X, Y, and Z. This is what we're doing. I like that. That's why I utilize the VA as much as I can, because I feel like they're all about me.
That's a great point, and I would harp on that myself. You go downtown, you're right, you tear up an ankle or something, you go downtown, okay, we need to get you an MRI. Okay, all right, somebody will give you a call at some point to schedule the MRI. You get the call in a few days, and we got an opening on August 3rd, and okay, that's 3 weeks away. Well, that's when we have the next opening for an MRI. All right, where in the VA, you're right, you need an MRI. They're on the computer, on the phone, and sometimes same day, you can literally walk down the hallway or limp down the hallway if you tore up your ankle, and you're getting your MRI, and your doctor has the results that afternoon, and then he or she's on the phone with you saying, oh yeah, we're going to need to do this, we're going to need to do that. It's that quick, and that's what I really, as Jim talked about, that's what I really like. Now, Tricare is a wonderful benefit, as Jim talked about. Right. It's insurance that your time in service, your retirement from service has earned you. And what I really like about it, as Jim said too, it covers your family. So I don't have to worry about a separate healthcare plan for the rest of my family. They can be on Tricare. But it's like any other health insurance. Who accepts it? Where do I have to go to get it? Okay, now I need a specialty consult, as Jim talked about, and that might be clear across the state. The closest person that you need to see that handles this, that takes Tricare, is in, I don't know, is in Washington, D.C., and you live in Delaware, so it's like, all right, so now I got to take a day out of work. I got to drive up there. I've got to pay to drive up there and see this specialist or what have you. Where once again, with the VA, I mean, you're going to the VA. And even if you have to go to a different VA to see a specialist, in our case up here in the Northeast, Boston has a lot of the big specialty things, and sometimes you get referred up to Boston. But the VA is going to pay you for that travel. They are going to reimburse you for you having to travel from your typical VA medical facility to another medical facility to get treatment.
So basically what I'm hearing from you guys is, I mean, it's not like Tricare is way better. It's not like VA healthcare is way better. They both have their advantages. They can work together.
You can utilize both. There's absolutely no issue with utilizing both. And I think the last thing I'll say is, with Tricare, it's a contracted provider. Like, there is no government Tricare. The government contracts out to different healthcare providers that then provide the service. So my point to that is that somebody who's a retiree living in Albuquerque, New Mexico, will have a different flavor of Tricare than someone living, in Hartford, Connecticut, because different providers bid on that contract in different parts of the country.
So they provide slightly different packages.
It could be slightly different packages, and Jim, you can certainly talk more about this than I can, because you've experienced this.
Yeah, well, and like I say, it's just like when you're working out in town and the business you're with decided to change health plans that year. Well, Tricare goes through the same thing. As you said, another contractor said, I'm bidding on it, and they win. So now whoever your last provider is new. So now the provider or the PCP you've been going to for the last 5 years may no longer be in your network, which changes things considerably. And again, I go back to when I go to the VA, I may not see my same provider all the time because they move to, but I know what I'm getting into every single time I go to that VA. I know where I'm going, I know what I've got to get done, and I know who's going to do it.
And I think the other point that's important here too is, you're on vacation in San Diego and something comes up, you can go into the VA medical facility at San Diego, and it's still VA healthcare, the same as VA healthcare you're receiving in, once again, Hartford, Connecticut, or Tallahassee, Florida. It's VA healthcare, where you're right. There's no such thing as out of network and all that kind of stuff when it comes to VA healthcare. You're enrolled, and you show up at a medical facility and you need a prescription, whatever. You need emergency services because you're on vacation and you fell down or something. You're not worried about, are they in my network? Are they not in my network? What's the copay for emergency services here in Oklahoma versus my copay for emergency services in Massachusetts, whatever, which is a typical civilian healthcare plan, which in essence, that's what Tricare is.
Sure.
It's not that much different than, say, Blue Cross Blue Shield or Humana or,
Right, who are the contractors sometimes. I think right now we have Humana.
Other people I've heard have Martin's Point.
Right.
So there's different healthcare providers that bid on Tricare contracts.
Interesting. Well, I learned a few things today. But there you have it, folks. A little bit of information about Tricare versus VA healthcare. Which one's better for you? Make the choice, but you can take advantage of both of them at the same time. So there you go. To all you out there who are watching right now, hit that like button, hit that subscribe button, follow us, make sure you don't miss an episode in the future. And for all of those that are serving in the military, former or current, thank you for your service.
You have questions about your VA benefits, and the SITREP has the answers. Visit any of our 4 YouTube playlists that specifically cover VA healthcare, VA disability, VA home loans, and specialty topics. Choose from any of our playlists and connect with the benefits you earned and deserve.